6:02. Madam Clerk, please note that all three of us are present, and we will move right into our committee discussion. So the first agenda item, we are very excited to have Miss Melanie Huggins, who's the Executive Director of Richland Library. And as you all may know, they do some great work with connecting our citizens to different social services within the library, given that it is often a safe space and a community point to engage with different resources. And so after the task force completed its report, I had the opportunity to sit down with Melanie, who presented this Do Good Columbia grant opportunity that they had. And so many of our task force members participated in this process, I'll call it, of really thinking about broadly what we want to do long-term to address some of the various issues and ideas and challenges that were raised around homelessness during the task force meeting. So I'd like to invite Ms. Melanie Huggins to the podium to share a little bit about what they found. Yes, please.
Good afternoon. So good to see you all, and really good to see you. I'm glad you get to sit down for a second, Kamisha. It's so good. I'm Melanie Huggins, the Executive Director of Richland Library, and it's my pleasure today to be here to give you an overview of some of the findings of a 3-day event that we held called Do Good Columbia. First, a little bit about Do Good Columbia. So Do Good Columbia is a human-centered design, problem-solving, design charrette, for lack of a better word, that the library has designed and we have implemented several times since 2017. The first time we ever did it was about how do we make the rivers more enjoyable and accessible. And that led to what you now know as the Waterworks building being renovated, the mural down there. So the process of the library's role is to be the neutral convener. We don't normally have a dog in the fight, as it were. We are the neutral facilitator of how do we get lots of diverse voices, and we really focus in the Do Good process on making sure we're hearing from people you typically don't hear from in civic engagement. And we think about what we do as participatory democracy. So we've done it several times now. The most recent one is the one I wanted to talk to you about, which is Do Good Columbia 2023, which we held February 1st, 2nd, and 3rd. And on those 3 days, we had 66 participants, and we were very deliberate about who those participants were. We invited everyone that was on the city's task force to participate, and many of them did. Plus, we had over 33 service providers that serve people facing housing insecurity or experiencing homelessness represented. Kamisha, I think it was your first or second week on the job. I mean, it was really early. I think you started in November maybe, and you were still just getting hired, but she was there, she participated, and it was fabulous to have you there. We divide them into teams, and on every single team, there is a person with lived experience. So we went out and found people experiencing homelessness to be on every single team, and we paid them for their 3-day participation. They got a stipend. We also paid people experiencing housing insecurity to come be interviewed. At the end of the 3 days, every team gives a pitch of what their idea is. And the idea has constraints because we know it's easy to think outside of the box. It's easy to come up with ideas that cost millions of dollars, but it's really hard to come up with ideas that have time constraints and budget constraints. And so we asked them the question of how might we strengthen support and collaboration among service providers working with people experiencing homelessness and people with housing insecurity. That question came directly from the city's task force work when what you found was that people were working in silos and not working together to solve this issue. So that's the question we spent 3 days exploring during Do Good Columbia. All the teams presented their ideas. We used a program on our cell phones to vote for the winning idea, and the winning idea actually gets $30,000 to turn their idea into something useful for that community. What you have at your and themes that we heard in every pitch. And again, while the library certainly serves this population, this is not the library's recommendations. This is what we heard from the people participating, the service providers and the people experiencing homelessness themselves, and over in each pitch. And I just want to walk through a couple of those with you and tell you what we're doing next, and then if you have any questions, I'd be happy to answer them. So over and over again, we heard what you heard in the task force too. And this was not coming from city staff. This was coming from the providers themselves saying, we need to do a better job collaborating. And I think it means a lot when it comes from the providers themselves. I mean, it's like you can't, somebody can't call your own child ugly, but you can. Same thing with this. You can say we're not doing a good enough job, but it's hard to hear it from somebody else. So over and over again, they talked about ways they could connect and share resources. They talked about the role of MOC a lot, and there were several executive members of the board of MOC that were there all 3 days. And talking about what is really their role. It's not just to distribute HUD funding, it is also to strengthen collaboration. And the MOC Executive Board and I have been in close contact since this day, and that is exactly how they want to position themselves, as the convener, as the key collaborator. Every single pitch that we heard at the end talked about how we use technology differently and more effectively. And actually the winning idea was to create an app and QR codes that if you're homeless, you can use your phone wherever you are to, shoot a picture of a QR code, get up services that you need right away. However, that won't work if we don't have good source data. And that's when you see the part that says consolidate resource documents. The city has a service catalog. The library has a emergency services catalog. Reggie Solis, who is a member of the community of people experiencing homelessness, has a wonderful website called Needful Things. There's a national platform out there as well that tries to catalog Columbia's data. So which one are we using? And how do we keep it up to date? The service catalog the city commissioned was fabulous, but it's already dated because it was printed in July of 2022. So how do we use technology? And then how do we incentivize all of those service providers to actually make those updates and say, hey, we don't have money for this program anymore, or we're not doing this anymore. And that was a key message we heard again and again. And then lastly, the client control of their own data. We all in an emergency probably would know where to find our social security card, our driver's license, and our birth certificate. If you are experiencing housing insecurity or homelessness, what we heard over and over again, that having access to those vital documents is key to your being able to get permanent housing. And what we heard, it was a surprise to me, and probably not to some of y'all during those 3 days, was getting those documents can take up to a year. So saying that you're going to put someone in housing for 90 days while they get it all figured out, they're not going to have all the documents they need by the time that they have to leave necessarily to get an apartment, despite the best efforts of the service providers. I do not know the answer to that. Kamisha, do you have any response? I don't know. It's a federal thing it's a state issue in some ways, but. Mm.
Misha, how does DHEC play into all of that? Or do they play into all of it, any of that?
Yeah.
Well, DHEC is a different animal, but if you're from South Carolina, it's a fast process. I'm from New York, so it may take a little bit longer. But then remembering that we are working with individuals who have been experiencing homelessness for 5+ years, and they're older, and sometimes parents didn't put things together properly. So I have experienced that we've actually had to go to documentation to prove that this is who they are, and that can take some challenge. Those are some challenges.
You know, the reason I asked that is several years ago, I wanted a copy of my birth certificate. And I went down there, filled in whatever the paperwork that I need to fill in. And within a day, I think, went back over there and I got a copy of my birth certificate. Now, I guess I probably see more of that. You see probably more of that now, especially if a person has been homeless for 3 to 4 or even 2 years. and how that process could very well speed up itself. And if it could speed up itself, what benefits? All right, I got a better feel on it now.
And if you're a transplant here,
Yeah, if you're
that's the other
transplanting,
thing.
it becomes more tedious. I
And
would
you
think.
probably had to have your driver's license or social security card in order to get your birth certificate.
In-state.
So it's kind of it's a trick, it's a domino effect. You gotta have that, is that when clients go to a service provider and they say, oh, you need this document in order to get this funding or this housing opportunity, the client, the service provider might pay whatever it costs to get those documents because they're not free. So they might cover the cost, but then they'll hold it because the person that, and that makes sense, right? They want to keep it safe. So is there a way that clients can, we take for granted that we have agency over our own documents. That's the takeaway. And that there are a lot of people experiencing homelessness that do not hold their own documents for safety reasons or security reasons because they're living on the street. They might be in the cloud somewhere, but they don't have access to it because the service provider has access to it. So that was a theme we heard over and over again. Is there a way to that lives in the cloud, that if I'm homeless, I don't have to keep it on my person, but I can also bring it down? Told about HMIS is that the management system that is being used, or some of those management systems. But then the other challenge you'll see is that not every service provider uses HMIS or has to use HMIS, and it's clunky and they don't like it or they haven't been trained on it. So it's the thread through all of this is we want to give the people experiencing homeless more agency, whether it's through their or owning their own documents and having access to them whenever they need them, but that's going to require an investment in technology. Who is going to train all the service providers to use this, module if it gets added? And then I think the last thing I'll just share is that the winning team, and you can see all of the trends and themes, and trust and transparency in and among service providers came up a lot too. Is that, I know from the library's perspective, and we do know because my staff has described the Rapid Shelter team as responsive, friendly, fast. They're like, when we call them, they get back with us. We know they're going to take care of we've referred over 60 people to the Rapid Shelter from the library. And we even have a screen like this in our social work center where it shows where you are on the waiting list if you've applied. So anybody that comes in the library can see where they are on the waiting list. And I can't say enough about what good job they're doing. But we need that trust in all of our service providers. We need to know that if we call you and say we're sending somebody over, or we want to know if you can help somebody, that's going to be a warm handoff and they're going to get taken care of. They don't all have the same service standards, is what I'm seeing as an outsider. The service standards vary, very different from one service provider. They all care about the homeless, but the people experiencing homelessness, but they might not all address it in the same way or treat people in the same way. So I'll just lastly say that the winning team is continuing to work with the library staff. We're going to project manage their idea to fruition. And because their idea was about an app, which we know with $30,000 will not develop an app, but what we want to do is try to figure out a way we can take that service catalog that the city has developed, take Reggie's Needful Things website, take the library's emergency services catalog, and make it a living, usable, useful database. Because if we're going to build an app someday, we got to have good content. We've got to have a good database to go by. And thankfully, the library's job is information referral and information retrieval and information architecture. And so we can help guide that piece of the process so to make sure we're all literally working off the same page so that when you refer someone somewhere, you have timely, accurate information about what services they provide because it changes so frequently. So I'll just stop there and say, again, I'm just representing the person who facilitated the 3 days and one small piece of the service provision puzzle. These things what we heard the providers and the people experiencing homelessness and housing insecurity say over the course of 3 days. And that winning team gets $30,000 to spend to figure out how they're gonna start putting some things into action. One idea they had, in addition to QR codes, was having a decal on business windows or organizations' windows where it was a place where you could get a referral, where it was a place where you would know, oh, the library can help me. Oh, this organization is one of those partners that can help me get into the system and start, getting my case managed by all of these folks. So I will keep you posted on the winning teams idea. I'm sure this is the first iteration of that, and I know there will be opportunities to invest in what that online access point looks like in the future.
Just hypothetically,
Mm-hmm.
how would that be in terms of welcoming businesses? I think you said you put a little sticker on
Mm-hmm.
their doors or windows or whatever. How welcoming is that? And has that process in itself been defined?
So what we're thinking is that the winning team's idea was that you would be able to, on your phone, scan a QR code and get access to a database that would say, here's all of the services. Like, no matter what time of day, you could scan something and you would go, oh, I need food. Here are the places that are open right now. Here's somebody I can talk to right now about that. But that's kind of the big, like, nice, swanky model of the project, right? But we've got to boil it down into what's doable. So a low-tech way of doing that might be just a decal that doesn't lead you to necessarily an access database or a database online, but leads you to a person. Like, you might have one downstairs on the window of City Hall, so anybody who needs help knows this is a place I can walk in and at least somebody can say, hey, go to the library, or whatever. It's a starting point. So a business who wanted to be welcoming could say, here's some places that I know of. You need your clothes washed? I know where that is. So there's more people that have eyes on it and more people that can be referrals.
So I thought it was interesting that one of the biggest challenges we saw in the task force discussions was the after hours and weekends. And this on-call model for providers, I think, is worth exploring. But it just seems like we're kind of at a halt there where there really hasn't been a solution yet to identify ways in which we can fulfill the needs, and the city can't do it itself.
That's right.
So I'd be interested to hear if there was anything else you heard about potential solutions to address after hours and weekends.
So we did hear every person's pitch had a scenario in it where the person needed help on the weekends or in evenings. And some of their ideas were subsidized rideshare, which I think we've tried some of that before here in Columbia, where if I'm after hours and I need transportation to a shelter or transportation to somewhere, that there was a way you could get subsidized rideshare. That was in a lot of people's ideas in this 3 days. We did talk about in some of the tables, it didn't make it anybody's final pitch because I think they just don't know how to make it happen, which is that on-call model. Could you have a group of partners that, just like doctors' and surgeons and other people, where you agree to have somebody that's on call after hours or on certain weekends, and if you have enough, it might only be, once a quarter. Because not everybody provides services from 9 to 8 like we do every night, or 9 to 6 on Saturdays, or 2 to 6 on Sundays. So what could we structure something like that? But again, I think it's going to take someone like the MOC or someone who is a neutral convener of that has influence and resources to put that together. I think it has to be about coalition and collaboration building first, so they trust each other. And they really do want to make that work together. I know Kamisha might know of models like that already work, that are like on-call models that we could learn from.
I was thinking when you first started, you said how the partners themselves said that
Yes.
they can do a better job at collaborating.
Yes.
Did they talk more about what that looked like? And if we were going to go after that model that provided services after hours, it would have to provide all of the services.
Right.
So not just me being able to make contact with Mary, where am I gonna take Mary to sleep at for the night? So it's a lot.
And 100%, you are so right. And I think that's what stops us, is because we want to solve the whole problem and not put constraints around part of the problem. Part of the problem, talk to each other unless they have to. And that's what they said over and over again. Like, mock is great, but mock has become more about HUD funding than it has been about convening and collaboration. So one very simple thing that all the providers said is, we just need to go tour each other's facility. We don't even know what your facility looks like. We don't even know what services you provide. And so we talked about using some of that $30,000, as simple as it is, to incentivize people coming together. They talked about doing it over Zoom if you can't do it in person, or having, breaking bread together. So they were like, we don't know what you provide, so it's hard for us to trust that if I send somebody to you, it's all going to get worked out. So I think what I heard, the big problems are the ones we all know of, but it's how do we get there in steps and increments? And I think part of that is, how do we incentivize more collaboration, more sharing of data, more sharing of information, and agreeing to have one access database that where all the services for homeless are. And again, is it going to be Midlands? Is it going to be just Columbia? Is it going to be Richland County, Lexington County? That's another thing. I think the one that y'all funded had 100 service providers in it, and I think it was across Lexington and Richland County. But what is that? Is if we build the database, you got to keep it up to date. You got to make sure that if a program runs out of money, you put a line through it in there, so we're not sending people to something that you no longer have money for. That is a first step into doing anything more elaborate with an app or a QR code or even an on-call model. Just having that one place where all of us can go and see that we know this is an up-to-date list of services. And we've got a lot of great information to start with. We just don't have any incentivizing of people to use it and keep it up to date. So we've got to figure that. And that's part of this group that's getting together next week that's working on this project. They're going to have to figure that out. And some of the people working on it, again, are people experiencing homelessness right now. Some of them are service providers. And then we're inviting the mock leadership to also be a part of that conversation. And you are welcome, if you have the time, to come be a part of that. And I'm sure they're going to say you by name anyway once they meet next week about coming. But we've got to have the service providers bought into it. And who do they trust to do that?
Yes, Councilman.
Melanie, thank you for what the library does, because when Kamisha sends out her weekly report, usually Richland County Library is the #1 referral, so I know that y'all are doing a good job over there. My concern is that the city of Columbia does not have the resources to do all of this. And how do you bite off a piece of the elephant so you can chew that up without getting the whole elephant involved?
Well, so you spend, what, 30-something million annually by your count on homelessness? It was...
Not the city, just in terms of the top 5 or 6
Okay,
providers.
but whatever
yeah.
the city spends on that and who else, what are the requirements of getting that money? Can one of the requirements be that as a partner of the city in this work, you have to commit to, whether it's using HMIS or keeping whatever this database is we get cleaned up and out there? I mean, you do have policy and practice influence. You can't make people collaborate, but you could certainly put in some constraints or some criteria in those grants and awards that would incentivize people to contribute to a shared database. Because until we have it, we can't build on bad information. I mean, that's librarianship 101. You can't build on information that is not current. We have to keep it up to date, and we have to all contribute to it.
And Councilman, the lack of collaboration is at a very basic level at this point, where Kamisha couldn't even get approved as a member of the MOC yet to formally represent the city. So I think that we start small and look at some of the ways in which we have, you know, political and social influence in order to address some of these things and ensure at least that we have a seat at the table, as we are the only provider in some ways that's providing some of those after-hour rapid services.
First of all, I think $30,000 is not enough, and to do
Oh,
all
no.
what you,
Right.
and I think that's a common thread in this conversation. The other piece of, the other piece of this is, it would seem to me, just for clarification purposes, there needs to be a real deeper dive into some of these concerns.
That's right.
And in so diving deep into these concerns, I think we walk away with a real clear understanding of what it is the city
Right.
is going to continue to do or will do. Right now, I mean, I'm sort of intrigued with this OR code. QR code. When I said OR, there was OR. I'm looking at that QR code, which I think could very be beneficial for our city and to our city. But there needs to be some clarification in terms of our residents, in terms of persons in the community. What does that code mean? What does it mean that this is a place where clothes can be washed? Or if you've got a cell phone, how do you bridge that gap? And of course, those are the kinds of particulars that I would be interested in. And I think it would sort of lead into a real comprehensive approach to these other 10 issues,
Yes,
10 concerns.
I agree.
So a deeper dive, and perhaps, Madam Chair, coming back, I would think, at another time, looking at those things and sort of disseminating what it is we can do realistically.
I think that sounds great. And the $30,000, I should say, came from the Nord Foundation as a grant that the library wrote. And the $30,000, if you looked at all of these trends and themes, they overlap. And some of them are just values. Some of them aren't even things to do. They're just about valuing collaboration and acting differently as an organization. All on that one theme of consolidated resource documents. Even so.
I mean, I
know we're
still
over
think
time.
it's thinking about where we started and how, you know, like you said, I don't know the exact phrase you used about it's easier to call your own
That's right.
baby
Well, that was
ugly
probably
or-
a terrible way to say it, but
But
yes.
but I think that speaks to some of the work that we've been doing because it's easy to be defensive in the beginning, like, no, everything's going great. And the fact that you're having providers admit that, hey, we don't even trust each other, that to me is like the beacon of hope in this process, that people recognize that things aren't perfect. So hopefully we can channel some of that momentum into moving in the right direction.
And I think they wouldn't have said that if they didn't trust the library and they didn't trust that process. They would not have been as forthcoming. And they didn't say it on the first day,
I'm sure.
but it came out over the course of the 3 days
Yeah.
that, you know, we've got some fundamental collaboration issues. And I can't say enough about the mock, so I'm glad that you're going to be involved. There is new leadership, and they really are trying to take it in a little bit of a different direction. So I hope that that coincides with all this work that we're doing. But thank you for your time, and I would love to come back another time and talk to you about the social work team and what they do, because Kamisha, they love working with Kamisha and her team, and they do a lot of things I don't think people are aware of, so might be of interest.
We would love that.
Yeah.
And I'm sure we'll stay in touch about the winning
Yes.
team, and if there's
Yes.
a opportunity where we can align some of the work.
Yes, we will
love
let you
to.
know. Thank you so much
Melanie.
for your time, I appreciate it.
Thank you.
All right. Well, we can then move into our next agenda item. This is an update and overview on the Alliance for Healthier South Carolina. I have been fortunate to work with Mr. Monty Robertson for many years now, prior to coming onto council. One of the things that the mayor expressed, as well as Councilman McDowell, was wanting to get more involved in terms of the public health role that the city should be playing in terms of addressing some of the adverse health outcomes and disparities that we see across different zip codes. And so I thought that the Alliance may be a great place for the city to formally get involved, but of course would love both of y'all's feedback and support for us to make a formal recommendation to do that. So I'm going to pass it over to Monty to talk a little bit about what the Alliance does and how the city can play a role.
Thank you so much. Thank you for having me. I'm here to talk about the Alliance, but I'm also a resident of Columbia. I live literally 3 blocks away. So this is personal for me too as well, because of course I want to see the city grow and get better and improve the health and well-being of Columbia, South Carolina. So I'm gonna hop right in, and I got some slides. Hopefully this keeps you guys awake.
This is interesting. We're going to stay awake.
Yeah, and Dr. Bustles, I know I'm speaking your jam with this, but I like to show, before I talk about the Alliance, I really like to show this to really describe to you all what was the impetus behind developing the Alliance for a Healthier South Carolina. So let's go back to 2000. A bunch of leaders from mostly hospitals to try to understand how do we improve the health of our state. We're doing a lot of great work, but just really weren't seeing the needle moving. And so quickly that group realized that in order to improve the health of our state, we're gonna have to go beyond the walls of hospitals and clinics, right? That's clearly demonstrated by this document from County Health Rankings and Roadmaps, where you can see only clinical care attributes to 20% of your health. And of course, there's all those other factors like social and economic factors, the environment, health behaviors that really play have a huge impact on your health and well-being. And so that was really the impetus behind forming the Alliance for a Healthier South Carolina, because we knew hospitals couldn't do this on their own. We need to work with other partners in order to improve the health of our state. So as you can see, what our mission and vision is, we convene and connect diverse stakeholders to align and catalyze efforts to improve the health and well-being of communities across South Carolina. And certainly we have a vision of an optimal, a South Carolina with optimum and equitable health care for all. And we like to stress the word all. So, independent of your race, your age, where you live, any of those factors, we want to ensure that everyone has a fair and just opportunity to be healthy. So just to share a little bit about how we were built. We were formed on the collective impact model, which you can see the 5 components, and certainly I'm probably preaching to the choir here, but just want to reiterate how we were formed. And this will play into what I share about the State Health Improvement Plan later, but of course that common agenda, what measures, what are we trying to improve, what are the different activities that all our partners can contribute to improving the health, and of course, got to have great communication. Melanie set me up for that, so we got to have really good communication, and then lastly, really that backbone organization. So just give you guys some historical context. The South Carolina Hospital Association serves as the backbone organization for one more month. So we have grown, we brought in more members, more revenue, and really matured. So time for us to fly away. So in a month from now, we will be branching off as a independent nonprofit. So we're really excited about this opportunity. Just to give you guys an idea of what our membership looks like, we have a couple new members that added or joined recently, so we haven't added everyone, but we're up to 63 members, ranging from hospitals and healthcare systems, state agencies, universities. We even have AstraZeneca, pharmaceutical company, just joined us as well. So we're really trying to broaden what our membership looks like. I know we have a lot of state level organizations, but we're now making a more direct connection to our community organizations as well. So we're excited about those opportunities that are coming ahead of us. So here's our approach to how we do our work. So first, education and awareness. We are very intentional about raising awareness about the emergent issues that are going on across our state and in communities. We also are very intentional about data. So we have a very close relationship with DHEC. I'll share a little bit about a project we're working on now. So we want to get data into the hands of decision makers like yourself. So if we don't know where we are, we can't know where we're going, right? And we can't understand what improvements that we've made. So we certainly want to make sure that we have data, but make sure we have disaggregated data. So not just the population level data, but let's break this down. Let's look at how it breaks down by race, ethnicity, down to the zip code level if we have access to that data, so we can have more informed decisions on how we do our work and how do we address those emergent issues. And then thirdly, that cross-sector collaboration, which is really the meat of what we do. We want to bring together leaders so they can work collaboratively for health improvement. And then that last piece around policy and advocacy. So we as an organization, we don't lobby, but we certainly are in the position where we can influence policy through education and awareness. We do have some members who do lobby, but we as the Alliance will never, we don't lobby. So just wanted to make sure we share that. But we also have an opportunity to influence policy at the organization level. So I'll give you guys one example. In the middle of COVID, we have a lot of our members that came to us expressing the need to expand telehealth coverage because certain people couldn't go to the doctor at that time. So because we have Medicaid at the table, we have Blue Cross, Blue Shield at the table, we're quickly able to connect with those members and make those changes very quickly. One other example, we were looking at expanding postpartum coverage for women. South Carolina's Medicaid's rule right now is 60 days postpartum. We were able to get that expanded to 365 days, and we didn't have to go to legislators. We simply had those connections with Medicaid. We were able to pick up the phone call and just have a conversation about it. So that's just really just a couple examples of the power of collaboration, and that we've created this space so that people have built relationships, have built trust, where they can call each other, have those conversations. And then just want to share a little bit about how we convene and connect. So we have a quarterly meeting where we bring together senior leaders who represent those 62 respective organizations. So we bring them in a room together so that they can discuss emerging issues, where they can network. It also gives you an opportunity to have a seat at the table where you can influence the work that we do as an organization. So many benefits to being at the table as a member of the Alliance. We also have a couple action teams, which I'll share briefly about those, and those meet typically at least once a quarter. And then we host several webinars and conferences through the year. So that's just an expanded way of providing education, but also as a way to provide a space for folks to connect and network. And then lastly, we share lots of updates. So we do that on a monthly basis. So if you're a member, you have an opportunity to share about what you're doing, but also as an opportunity to get information about what's going on in the state. Yes, sir?
Let me ask you a question. You've got 62 Alliance members.
That's right.
Is that correct?
Mm-hmm.
What are they, just long story short, how do you deliver the persons in the community? I hear a lot of in-talking, but what about out-talking?
Yeah, absolutely.
When I say that, I simply mean it's good to have a collaborative approach
Mm-hmm.
to what's taking place at the Alliance, But what takes place in areas where folk are, for lack of a better word, suffering?
Absolutely. So we have those members. So me as the director leading the organization, I'm not going to be doing boots on the ground work, but we have Officer of Rural Health, we have hospitals, we have other community serving organizations who are at the table. And so when I gave you guys the example of telehealth coverage, that's an example that was a decision that was made at the state level, but it trickled down and was able to help folks at the community level. So we're really in the position to make system level changes that are going to impact your communities across the state. And so having access to folks who are in the decision-making positions, we can better serve the community. So one example, we have several foundations or grant makers. We can influence where the money is going, which I'll share a little bit more about how we're doing that. So it really is, like I say, a place where we can make system-level changes that then help and improve the community. And so one thing we're trying to do is have a better bi-directional communication between what's going on at the community level. So really leaning on the community to tell us what they need. And so we have certainly organizations who are community serving that are at the table with the Alliance to help inform us on what the greatest needs are for the community. And so like data. So you're gonna need data. We can work with DHEC to make sure you're getting the right data. So it's really that kind of system level changes that we're really aiming to do. Hopefully that, does it?
I agree with that. I agree with everything you said.
Mm-hmm.
The bottom line for me, of course, how do you take, and of course, Councilwoman Bustles and I have had this conversation several times. How do you take usable data and turn it into helping entities within the community? Now, I understand the importance of having an alliance with 62 neighboring, collaborating entities. I understand that. My thing is, how do we get at the heart of it, Monty? How do we get at the heart of it and folk reasonably can sense that not only do you have an alliance that is usable and friendly and doable, but how do you get, I understand that there are things and processes that you have to go through. But I'm looking at somebody who has hypertension or diabetes, and you cannot collaborate. You can collaborate on resources. Get this guy some help, or this woman some help.
Absolutely.
Does that make any sense?
Yeah, totally. And one of the,
And-
I think we might be getting a little step ahead of me.
Yeah, I was
'Cause
gonna say
one
the
of my-
state health improvement plan and some of the
Yeah, I was
examples
gonna
would be
have,
great.
I know one of our
Well, I don't
charges.
want to get beyond you now, because my issue is get some help for the folk.
Right, and some
Get through it.
formal
Get
and
through it, Monty.
informal recommendations that I think will answer your question. So I'll go ahead and address it. So one of the things that we're doing at the state level, so we have this state level coalition, right? But there's also local coalitions that are going to be the folks who can get down to the local level, right? So to my knowledge, I'm not sure, I don't think we have a local coalition here.
No.
So I know, so Vince Ford had led a charge to develop Rise Up Richland. I don't know if any of you guys were part of that. So I was at the table there. So to me, and I was thinking about this the other day, maybe we need to dust that off and get that back and running. I am willing and able to help get that up and running. I have years of coalition experience, and I can certainly help and be a resource to getting that local coalition up and running. So I think that's going to be a more local solution. And Ms. Huggins talked about it too. We've really got to focus on that collaborative piece of what we do. So that I hope that answers your question. In my eye, I see that as a great opportunity because the city can't do it by itself. The library can't do it. We're all going to have to come together. And it's going to be a multi-sector approach. We got to work with different sectors to bring them together And again, I don't think that's in place now, but certainly that will be my recommendation as a way to address some of these immediate issues.
Councilman Duval, I know you've been waiting.
Monty, thank you for your presentation. Erica sent the presentation out this morning, and I looked through it before I came to the meeting today, and it reminded me of a committee that Councilor McDowell formed about 2 years ago now, and we looked at different ways that we could provide direct health care information and have impact on certain illnesses. And Pam Benjamin did the staffing of it, and she came up with what I call the Baton Rouge plan. In Baton Rouge, they have something like Your Alliance that has the top dogs in it, the people that, the head leaders in it, in the center of the circle, and you got a slide in here that shows something like that. And then they had underneath that little bubbles that had different particular diseases. Diabetes is one that had
Heart disease, obesity.
Hypertension.
Yep.
Teen pregnancies.
Yep.
All of those. And each one of those teams had a leader.
Yep.
And that leader goes back to the executive team to get it. But that's where you get boots on the ground on a particular disease in a particular city. And we have not progressed on that, but I think that is the model we need to.
Yeah,
That's
and
the model we need to do.
I'll double check. So there is an effort through the Duke Endowment. It's called Healthy People, Healthy Carolina, and they actually provide funding to develop community coalitions. So what you're describing, there's several coalitions across the state who actually operate on that model. And so, and I was going to show you the state health improvement plan real quick. So essentially what communities have done has mirrored what we've done at the state level. So at the state level, we've completed a state health assessment. From there, we're able to identify what those, the biggest priorities are. And then we develop a health improvement plan. So at the state level, we now have a plan. We're in the midst of creating a new plan now because it's a 5-year plan. And then we develop strategy. So an equivalent to that, you know, for Columbia may be the same thing. What we did a data walk. So we brought leaders from across the state together. We shared the data from maternal and child health, chronic health conditions, education, income, everything we get we have the structure in place to do it. We would just have to do it. DHEC can provide the data for us. So we can do that here. Like I say, I can be a resource to help get something like that up. But I think in order to see improvements, greater improvements, again, it goes back to collaboration. Yeah, so right now, we are funded primarily through membership. So organizations pay, we have a tiered structure of a membership that they pay, and then in the most recent years, we've started to go after grants. So one of the cool grants that we got recently was through the Duke Endowment for us to actually improve our data. So I talked about how we're working with DHEC. So we got funding to build a publicly facing dashboard. So we'll now take databases and they'll link them all together and you can go to one centralized place. So we needed information from City of Columbia, we can pull that data and we can go to one centralized place to do that. So these are the types of things that we're doing to build at the systems level to help folks at the local level do their job better and provide them with the equipment and the knowledge and data to actually implement strategies for health improvement. So that's one thing we're going to do that's going to benefit the whole state. Another thing that comes out of that grant is we're going to have a performance management system. So right now, we don't really have a centralized place where we can keep up with what's going on across the state. So every county will now have a way that we can track different efforts that are going on so that we can see if there are improvements in the state. we can now see of the 46 counties, how many have ranked diabetes at their top efforts. So then we at the state level, we can help bring in resources that are going to go to the community. So we're getting more tools to be able to do our job a little bit better in South Carolina. So we're really excited about those opportunities as we haven't had those before. And they're doing this in North Carolina. So we have a blueprint, kind of what has worked in North Carolina, and we can certainly refine it and improve it for South Carolina.
I think that we were probably 2 years ago when Pam was leading us through this Baton Rouge situation, they did chronic conditions. They had diabetes, all the other things, and they had a committee working on that particular thing. Your program would provide the data to show whether the most chronic of the chronics for the city of Columbia or Richland County.
Yeah, absolutely. And I know there's Healthy Tri-County down in the Charleston area, and that they're set up the same way. They have different committees working on the different priorities that came out of their community health assessment. So certainly, I think that could be a great opportunity moving forward.
So I see here that you have the summit coming up in a couple of weeks.
Yes.
And did want to flag for my colleagues the great health equity pledge that you all take as you've shifted some of your efforts towards advancing health equity.
Yeah, so one of the couple things real pledge to, but you as an individual can also make this pledge. So you can go to our site at healthiersc.org to find out more about developing a kind of learning collaborative where we're going to be very intentional about making connection with folks at the community level to our state level folks, because they need to hear from the community directly. And so we're being more intentional about making that community and state level connection. So we're in the process now developing what that learning collaborative of community, wherever you want to call it, what it looks like. But it's going to be a place to learn how do you help those who need help the most, but also how do you influence changes specifically at the policy level. So there's a couple of things tangible things that we're going to be doing going forward. And then the other part that our other thing that we're doing is the opportunity to provide education and awareness. We're specifically looking at intersection of health equity and mental health. So got a community level leaders, state level, and national level leaders will be attending that conference.
Could be a good opportunity for some of
covered
us to attend as well.
It all?
I
Yep,
think so.
and I talked about the state health improvement plan. Certainly provides a blueprint for our state, but we'll have a database so we can keep up with all the great work that's going on across our state and help deploy resources to the right places. I think that sums it up. That's
So
content.
my question to you both is this something that you would, you think that we should recommend we as a city get involved in, the Alliance? Yeah.
Certainly, this is a statewide organization, and we need to pattern it after what we need in Columbia. And I like the Baton Rouge program, which fits in real nicely with that. Monty's organization could help us pinpoint which are the top 5 thing. And the thing about the Baton Rouge plan is scalable.
Yep.
You might start off with 2 or 3.
Priority areas,
And
yeah.
as those committees get up and working, you say, well, we've got 2 or 3 other problems over here. Let's get a committee working on that. The key to it, I think, is having the executive team include the leadership of the smaller teams so that they could communicate with the statewide organization to get funds and to use the dashboard. We love dashboards.
Yeah, absolutely, and
Well,
that's one of the things we help with too. So we get information about grant opportunities and other ways to fund the work that's going on. So we certainly be a resource there, and as a resource to build a local coalition as well.
But the other thing, Dr. Bussell, the other thing that I think is noteworthy, I think, yeah, we need to move forward with this. One of the things that I like is that you look at the 46 counties in South Carolina and bridging all of that information into one, for lack of a better word, general hub.
Yep.
It gives us a better picture and a better look at what's going on locally in municipalities everywhere.
Mm-hmm.
The other side of that, Pam, I think it gives us an opportunity to at least go back and revisit in a small way that whole issue of what we did in New Orleans and what New Orleans was all about. That would help. We backed off of that for another emphasis and another direction. But it would certainly be good that we could perhaps, Dr. Bussell, continue with this conversation.
Sure.
Continue with this. Thank you, ma'am.
Thank you, Monty.
Great. Thank
Appreciate
y'all
it.
so much. Please feel free to reach out if y'all have any questions. Thank y'all.
Thank you.
All right, we've done our social, we've done our health, and now we'll move into environmental. And we'll pass it over to Ms. Dana Higgins to give us a overview of washable utility marking paint, which hopefully is as exciting as it sounds.
Thank you, Dr. Bustles. Get my presentation up here. Guess we'll hold up for a minute. Okay, thank you for letting me come today to talk about utility marking paint. Just to give you a little bit of background, I know constituents sometimes contact you as council people about what the purpose and background and what kind of control we have over that. So we're here to kind of talk a little bit about that. So the different colors for each utility is dictated by our APWA Uniform Color Code. So the paint markings are color coded based on what type of utility. So electric would be yellow for, we have blue for water, green for sewer for the city of Columbia. That's typically what we mark. But then you'll see the other paint markings, pink typically when there's temporary survey markings, some of our capital improvement program projects. But then you also have electric and gas. There are two type of paint materials, one solvent-based and one water-based. The city uses water-based, but like Dominion uses solvent-based. So diving into a little bit more about what we have control over as a city, we researched with legal, and in June of 2012, the Underground Facility Damage Prevention Act was passed, and part of the reason they pass this is for contractors digging, excavating underground to have a central notification center to notify of the location, giving utilities an opportunity to mark their utilities before they put their backhoe in the ground. And the requirements of this law, this act, is for utilities to go out and mark their utilities. They're given 3 full business days, and on the 4th day, the contractor is allowed to start digging. So as a utility, we go out and mark our water and sewer lines within those 3-day windows. As a utility that also has water line breaks, we wait till the 4th day before we dig so that other utilities can mark their lines. And the requirement is for the paint markings to last 15 working days. They have to last 15 working days. Another important part of this law is that we, as a municipality, we cannot pass a local ordinance requiring what type of paint these utilities are marking with, and we can't make them wash them off after a certain period of time. So that was definitely something we were looking into, hoping that we might have a little bit more control, but unfortunately, this law had already thought of it, and we don't have that opportunity. But what we are working on is the city uses water-based paint to mark our own utilities, that's water and sewer. And we request that utilities working within the city limits also use water-based. On our utility application permit, we have a statement, and that's highlighted below. We worked with legal on this. We prefer for you to remove your utility paint after construction, and we would prefer for you to also use water-based, but unfortunately, we can't say shall, just because of that Damage Prevention Act. And one other thing that we are doing is looking into other paints. Right now, ours is water-based, but typically that lasts 1 to 2 months. Solvent-based, I think, is more closer to 4 to 6 months. There is some materials out there we're looking into that will meet the 15-day working period, but also maybe we can remove it after that construction period. So that's something that we're sampling now. So that's just the update, just short and sweet, and I'm happy to answer any questions or.
Yes.
Dana, when you call PUPs, do they come out and mark all of the utilities or just the electric thing? You have to go out and mark
So-
water and sewer?
So PUPS is the central notification center that was created as part of the 2012 Prevention Act. PUPS sends out to all their members, which is us and Dominion, all the utilities are members. They get a ticket request. Okay, in this location, a contractor is going to be digging. So then we have to deploy our utility markers to go out there and paint the lines.
So the PUPs people just tell you, go mark this.
Yes,
one.
sir. They're the notification center.
So, for example, you said that Dominion obviously works very closely with us, but they continue to use solvent even though we encourage water.
We do encourage water-based. That is something that we're actually starting to have discussions about a little bit deeper, just because of the need that has been presented to us from council.
So it's not water-based, it's
Solvent-based, so oil-based, basically, yeah.
What types of questions, are you all getting questions from constituents about the paint? I have not yet.
Well, I've got, yeah.
They just curious what it is?
Well, I'll go back to my experience. We built this beautiful building on Gervais Street, 1411 Gervais Street. We were in it about 2 days, and then they came by and marked on the sidewalk out front from one end to the other with solvent-based paint that stayed there for probably
Months.
a year.
Yeah.
Yes, sir.
And that was I reckon my first experience with, they gotta have something else that will wash off quicker than that, because you look around the city right now, all the telecommunication companies that are burying these lines all over the city, go across over here to where we are working on the, emergency communications center.
There's
The
lines
OC.
everywhere, yep.
Yeah,
It's
that's right.
full of markings.
Absolutely. So we'll do our best to work with our partners. Unfortunately, we can't require them to use the water base, but certainly we are going to try to work with them and ask.
Typically a preemption of the local authority to control their own rights of way.
Home rule. Thank you, Dana.
Thank
Any
you so
other
much.
questions?
Thank you.
All right, I will take a motion to adjourn.
Move we adjourn.
All right, let the record reflect, we all agreed